Hi, I'm Cindy Tilton. I'm the Director of Clinical Education, and I will be demonstrating donning and doffing of the coverall using a reused N95 mask and face shield. First, I will take off my personal items, including my name badge, my watch, my mask, and any jewelry that I would have had on. I inspect the coveralls. I'm going to look for seam integrity, any rips, and the overall condition of the coverall. I will perform hand hygiene with an alcohol-based hand sanitizer, palm to palm, palm to back of hand, fingers interlaced palm to form a steeple, left thumb rotation, right thumb rotation, cupped hands and locked, rub clasped fingers in the palm, and keep rubbing until dry. To destroy the pathogens, hand washing or hand hygiene or glove disinfection should take at least 20 seconds. Each motion ensures that each part of the hand is scrubbed. Before donning my reused N95 and reused face shield, I will don gloves, ensuring that the cuff is pulled all the way up the wrist or forearm. To remove the mask from the paper bag, I'm going to put my hand under the mask on top of the straps, making sure that I don't touch the inside of my mask. Put the bottom strap on first to the nape of my neck. The top strap goes on to the crown of my head. Adjust the mask at the bridge of the nose to ensure proper fit and to perform a seal check. Once the mask is donned, you must disinfect your gloves to do any further mask adjustments. I will do hand sanitizing. Because it's on gloves, it's going to take longer for it to evaporate. So you'll just need to continue rubbing until it dries completely. I'm going to hold my hands away from my clothes to prevent cross-contamination, and then I will put on my reused face shield. I will disinfect my gloves. I will now doff my gloves, grasping at the cuff, sliding it gently in a controlled manner up, cupping that glove into my hands. Slide your fingers under the cuff and peel it off your fingers and drop it in the garbage without slinging or snapping the gloves. And then I will perform hand hygiene. And I will put on the inner layer of gloves. Pulling the cuff up all the way. So I will don the coverall. The key thing is to protect the sleeves from touching the ground, as well as the back, the neck, from touching the ground. So I'm going to fold the back of it back down twice. And I will use a chair to then put it on. I will don the outer gloves, holding onto my sleeve in my palm to keep the sleeve inside my outer glove. Pulling the glove all the way up as far as it will go. The last step in donning PPE is to have a buddy check to make sure that proper donning has occurred. My buddy today is Eric. He's going to check to make sure that my PPE is properly donned and fits correctly.
Looks okay.
The doffing process begins before leaving the patient care area. I will begin with hand sanitizing. I will now doff my outer gloves. And put them in the garbage can. And I will disinfect my inner gloves. I will unzip the coverall using the lanyard attached to the zipper eyelet. Using the buddy system, I will ask my buddy's assistants to doff the coveralls by sliding the coverall off my shoulders and rolling them inside out. Once he has it to the waist level, I will continue rolling it the rest of the way down. And I will use a chair to assist with doffing the rest of the way. And I will now dispose of it into the proper bin. And I will disinfect my gloves. And I will proceed to the anteroom. Because my hands were contaminated getting out of the door, I will do glove disinfection. I will get my paper bag ready for my mask, and I will pull out a purple top wipe and get it ready to use to wash my face shield. I will then doff my face shield using the disinfectant wipe to clean the inside first. And then the outside. I will disinfect my gloves. I will doff the N95 by removing the bottom strap first. And then the top strap. Place it in the bag, the straps on the outside of the mask, and being careful to not touch the inside of the mask with my gloves at any time. I will disinfect my gloves. I will take off my inner gloves. And hand hygiene or hand washing as appropriate. Proper hand hygiene and glove disinfection has been demonstrated throughout this video to emphasize its importance in preventing the spread of disease. Thank you for watching, and I hope you find this training beneficial while caring for our patients to keep them as safe as possible.